Good day. My name is Michelle Lavander. I'm the director of the USC Center for Health Journalism. Thanks for joining us today for our Health Matters webinar, Extreme Heat, a Rising Public Health Threat. Before we get started, I wanted to mention an opportunity for the journalists joining us today, our upcoming fellowship focused on health and climate change, which we're offering in collaboration with our sister center here at the Annenberg School of Journalism, the Center for Climate Journalism and Communication. Please scan this QR code to learn more about it. You can also reach out to editor at centerforhealthjournalism.org for more information. The program includes reporting grants, a 2-day in-person program, and mentoring over 5 months. We hope you'll reach out to learn more. And now let's get underway with our webinar on health and extreme heat. Parts of Southern California and Arizona are under extreme health warnings today, with temperatures reaching above 115 degrees in some areas. It won't cool off much at night either. Earlier this summer, heat domes pummeled the Midwest and eastern half of the country. Periods of sustained heat are particularly threatening for low-wage workers who are outside, the elderly, the unsheltered, and people with chronic health conditions. There's even newer research showing that heat can accelerate our rate of aging, and there's a growing body of evidence linking high temperatures to violent crime. The public health threat posed by extreme heat is expected to worsen as climate change makes such events more frequent and intense. There are bright spots, though, in efforts to combat the health risks. Phoenix has managed to lower health-related deaths in the midst of a record-breaking summer through a variety of strategies, and there are a number of steps cities, counties, and states can take to lower health risks, even as new federal regulation remains unlikely. Today, we have a distinguished panel to lend context, outline policies that move the needle, and spur story ideas as we enter the hottest stretch of the year. We'll hear from Alejandra Barunda, who reports on climate change and human health for NPR. Her reporting explores topics such as how climate-worsened disasters impact people's health and how diseases like dengue fever are spreading because of climate change. Before NPR, she worked at National Geographic, where she reported on climate and environment issues across the U.S., Greenland, and Mexico. She has a PhD in Earth and Environmental Sciences from Columbia University. She's a 2025 Poynter Fellow and a 2025 National Fellow here at the USC Center for Health Journalism. Her project with us will examine climate change's toll at a time when official estimates undercount deaths by large margins. We're also going to hear from Catherine Davis Young, a senior field correspondent for Phoenix's NPR affiliate station, KJZZ News. She covers a variety of issues, including public health and climate change. She holds a master's degree in radio journalism from the USC Annenberg School of Journalism, where our center is based. She's produced work for NPR, New England Public Radio, Southern California Public Radio, The World, Washington Post, and Reuters. And lastly, we'll hear from David Michaels, an epidemiologist and professor at the George Washington University Milken Institute School of Public Health. He served as U.S. Assistant Secretary of Labor for Occupational Safety and Health from 2009 to January 2017, making him the longest-serving administrator in OSHA's history. Previously, Dr. Michaels served as U.S. Assistant Secretary of Energy for Environment, Safety, and Health, charged with protecting the workers, community, and environment around the nation's nuclear weapons facilities. Much of his research focuses on protecting the integrity of the science underpinning public health, safety, and environmental protections. His most recent book is The Triumph of Doubt, Dark Money, and the Science of Deception. This webinar is made possible thanks to the generous support of the California Endowment. We'll be archiving this conversation later today at centerforhealthjournalism.org. A word about our format today. We'll be hearing from our speakers first, and then we'll turn it over to our audience for questions. Feel free to share general comments in the chat. Because we have many people joining us on Zoom, we'll ask you to write your questions for our speakers into the Q&A panel, and you can also write us there if you're experiencing technical problems. Now let's get underway. Alejandra, why don't you get us started? Why should we be concerned about extreme heat, and what are the known health impacts of heat exposure?
Yeah, thank you so much for having me today. It's great to be talking to you all. We know so much. We know so much about both what is happening to heat across the US and the world, primarily because of climate change, human-driven climate change. And we know a lot about what it does to people, and almost all of it is not good. Um, I think it's, to me, one of the things that was really striking when I started on this beat was learning that heat can hurt people at levels much lower than one might expect. It doesn't have to be 115 like it is for Katie, or even hotter, maybe. It can start to have impacts that we can see in ER visits, in mortality, and all kinds of different health statistics at levels much lower than that, when the heat index is in the 80s, for example. Um, and I think another really important thing to know is that the risks are often much higher in parts of the country that are not accustomed. Well, not much higher, but they can be really impactful in parts of the country that aren't the Southwest, essentially, or the South. The Pacific Northwest heat dome of 2021 was incredibly destructive and killed many, many people, in large part because it happened in a place that didn't have the preparation and the knowledge base to manage it. The same is true across the Northeast, across a lot of the Midwest. This is a problem for everyone. Um, I think one of the things we know really well is that there are some very visible outcomes. We know that heat stroke can drive, or heat can drive heat stroke and heat exhaustion. It also, like Michelle was saying, exacerbates a lot of other health conditions, um, from heart problems, cardiovascular issues, to kidney problems, to brain issues. Dementia can be exacerbated and worsened by a heat exposure. Of course, respiratory issues, asthma, many other kinds of breathing problems. And the body can acclimatize in some cases. It can adjust a little bit, but there are really hard limits to that. And so we can try to work on the ways that we are, managing ourselves in heat, but we can only go so far. Um, I think I just will throw this in here. One of the best tools we have to manage heat across both personally and policy-wise is to be able to get people into air conditioning, which is hard, expensive, not possible for everyone, but I think that's a conversation that we really need to be having right now. Um, like Michelle was saying too, very important to recognize that the risks are not evenly distributed. We may think that heat is a problem, we're all feeling the same heat, but we're not. We're not people who are working outdoors, like she was saying, people who are unsheltered, um, people who are, for whatever reason, just exposed to heat more often or at more intense levels, experience a much bigger risk. And that becomes even more important if you don't have a cool place to go home to in the evening to recover from the heat of the day. We know that that overnight cooling period is incredibly important to maintaining bodily homeostasis, to making sure that your body core temperature can cool back down. And so for people who don't have a cool place or an air-conditioned place to go sleep, end up having a lot more impacts. There's also a lot of evidence that there are historical patterns of development and inclusion and exclusion that affect people's heat exposure. So there were a series of really insightful pieces of literature published a couple of years ago and continuing to be published that looked at the relationship between redlining and the urban heat island. And there's very clear evidence that parts of cities and communities that were previously redlined and underinvested for many decades of the US past are now up to 15, 17, 20 degrees hotter in some cases than other parts of the exact same city. So if you think about that, if you're living in one of those neighborhoods, you are routinely exposed to a much higher heat load than you might otherwise be. Those are some of the health impacts. I'm happy to talk about climate change too if you want, but did you have another question, Michelle?
Yeah, I'm just wondering, in the context of climate change, what do we know about the changing risks from heat? And is it getting worse, these heat issues, because of climate change? And if so, how do we know that?
Yeah, I think this is a really important part of the conversation. Heat has always been a problem. I mean, everyone has experienced hot weather. There have been periods of extreme heat in the past. There are stories of it in books and texts from many, many, many years and decades and centuries ago. Humans are absolutely making the planet hotter. And as that happens, the extremes get more extreme. Here, let me share my screen very briefly. Um, I really like this figure from, you're all going to see my absolute chaos desktop. Um, if you can see that. I really like this figure from Climate Central, which is a nonprofit group that does a lot of climate communications and data analysis. And one of the things that I think is often kind of misunderstood about this question, so the planet has warmed about 1.2, 1.3 degrees since the late 1800s because of primarily the human burning of greenhouse gases and other or fossil fuels, which produce greenhouse gases, which warm up the planet. As the average temperature of the planet goes up, you can see this little slider that goes to the right. The number of warm events and extreme events goes up even more. So we are moving into the tails of this temperature distribution and giving ourselves more and more and more chances to be in this far right side of the distribution. And so we're just increasing our risk of exposure quite a lot the warmer the planet gets. And we are on track to continue to warm significantly more unless some pretty drastic emissions reductions actions happen soon. And so what do we know about what's happened in the US? I often like to go to this EPA figure, which is still online. Sorry, I'm trying to expand it a little bit. You're gonna have to just see the rest of my screen, sorry. What we know is that the frequency, the length, the intensity of heat has increased significantly over the past decade since the 1960s. You can see here, the frequency has gone from about 2 to more than 6. That means we're getting many more periods of heat during any given summer. The length has increased from about 3 days on average for a heat wave to more than 4. And I actually think the 2025 to, or like the last few years have even been a little bit on top of this. This stat is really shocking to me. The length of the season, of the heat wave season, the season in which we are likely to get a heat wave in the US, has extended by more than 40 days since the 1960s. So Katie's living in Arizona, and now the heat season is basically like most of the year. That's a totally different environment that we're living in now. And of course, the intensity is getting worse too. Like the hottest days are getting even hotter. I think that's all I needed to share. So overall, I think that's just like very important context for us all to understand. Things are hotter. The heat is lasting longer. The heat, like Michelle was saying earlier, the heat is not dissipating overnight, which is a big problem. More nights are warming significantly more than days even. So if you split up all those bar charts I just showed you by nights, like the numbers would be even more intense. So we're just putting ourselves in a position to be exposed to a lot more heat and to deal with a lot more of the challenges and health issues that come with that.
Yeah, and let's turn now to David, and really the role of the government in addressing some of these, really notable and alarming shifts that we're seeing. The Federal Occupational Safety and Health Administration, or OSHA, has proposed a rule that would require employers to take steps to protect workers exposed to extreme heat. And some states already have heat protection rules. Where does this stand right now?
Hey, thank you, Michelle, and thank you, Alejandra. That was really interesting. So for workers, as I think all of us know, heat can kill, it can cause long-term health damage. Um, Not so well known, but very clear injury risk increases in extreme heat. Car crashes increase, and extreme heat impacts both outdoor and indoor workers. You're working in an air-conditioned Amazon warehouse increases your risk of injury as well as other conditions, even though you're not outside but during heat wave. Also, it impacts productivity. If you're working in extreme heat, you do less work and you do it less well. Of course, all of this is preventable. We know how to prevent it. I'd like to talk about three basic words: water, rest, and shade. It's a little more complicated. But I want to tell a story about sort of government intervention, how it can be effective, which is if you go back to March 2010, people will remember the Deepwater Horizon rig exploding about 40 miles off the coast of Louisiana. It was exploded, I believe, in March. Um, we knew that the oil was going to come to the shores of what used to be called, I still call the Gulf of Mexico, from Texas to Florida. And BP was going to have to hire people to clean up that oil. And even before the oil came to the shore, I flew down to Louisiana. I met with BP, and we said, look, there is going to be a major problem because you're going to be putting people in the unshaded coastlines of these states. They're going to have to wear impermeable Tyvek suits and hard hats and gloves, and it's going to be very hot. And unless we do something, uh, there will be deaths. And so I looked at the work rest matrix that the US Army was using at the time in Afghanistan and Iraq with young, healthy soldiers and said, depending on the heat index, which is a combination of the temperature and humidity, um, you could be working 50 minutes an hour and take a 10-minute break, 40 minutes, 20-minute break. But this is what you do to keep people safe. And BP voluntarily agreed to do that. I think they really had no choice. They'd already killed 12 workers and burned quite a few more, and more deaths would have been a really catastrophe on many levels. So they set up these huge tents with Gatorade and water, and people rested. And it was controversial. I took phone calls from uh, members of Congress, governors from that area, who would call me up and said, you know, I worked all summer when I was in college mowing lawns. I didn't take breaks. Why do you have all these breaks going on at the cleanup site? And I would say, sir, we're trying to make sure we don't kill these workers. And that usually ended the conversation. And it was a great experience. Not a single of the 60,000 workers who BP hired died from heat. And so we could show it can be effective. Um, Out of that came a voluntary campaign that OSHA ran with water, rest, and shade. And some employers embraced it, others did not. And the fact that many did do it showed it could be done, but the fact that not everyone do it demonstrated the clear need for a heat standard. And OSHA has never had a heat standard. A few states have standards. We have a system where a state can have their own OSHA program. And so California, Oregon, Maryland just issued one, my state. Nevada has a weak standard. Um, Washington State has a standard for outdoor workers, Colorado for agricultural workers. There's sort of a mosaic around the country, but most states do not have any sort of coverage. And we know that state standards do make a difference. California has actually had a weak standard in 2006. They updated it and made it stronger in 2015, and we saw a drop in worker deaths. I've also looked at data that show that injuries are very much connected with heat, and the risk is lower in states which have standards. So we know we need a national standard, or we need many standards to make sure workers are safe. Federal OSHA under President Biden proposed a standard. It's pretty straightforward. What says that, first of all, employers need to make a plan. They have to be prepared when it gets hot to make sure their workers are protected. What are they going to do? And water, rest, shade, acclimatization, because when you have a heat wave, it's different. People have to know what to do in an emergency. With the Trump administration, we're not sure where that's going. To my surprise, they did have a hearing, which I testified at. Many people testified. I don't know what to expect. In the past 20 or 30 years, Republican administrations have never issued health standards under OSHA, except when they've been required to by a federal court. For the journalists in the audience who want to investigate different companies and how they've responded to this, and there's been some really interesting work done on this. You could look at the comments in the proposed rule, and we could put up the link so you could look at. Now, there are 25,000 comments, so it's hard to go through, but I found that by using AI and you want to look for a specific company, you could put in name of a company or a trade association, ask ChatGPT or whatever platform you're using to say, have they commented on the OSHA rule? And the comment pops right up. And so what you could see is actually, it's pretty interesting. For example, United Parcel Service says we have a great program. It's a voluntary program. We don't need a federal standard because we have a program we think that works and we shouldn't be told what to do. When I testified, I pointed out that UPS has reported dozens of workers hospitalized for heat illness. Um, and so that could lead to some interesting journalism. In fact, NBC, a digital journalist at NBC did a really interesting job on UPS some years ago, where they looked at these same data and they showed increased risk of hospitalization. And they went out and measured the back of these brown trucks, the temperature in the back of the brown trucks, and found it goes as high as 140 degrees when it sits in the sun. Uh, Obviously, dangerous levels. And out of that came a lot of national interest. The Teamsters Union was negotiating a collective bargaining agreement with UPS, and UPS agreed to increase the number of air-conditioned trucks they were buying. So that's, I think, an important outcome that can come out of sort of journalistic investigation into this. Maybe it's one last point that's probably worth mentioning, which is a complicated issue around preemption. Uh, because there is no federal law, states can really do what they want. No federal regulation. States can do their own thing on heat standards. So state plans, state OSHA plans like California, uh, issue their own standards. They may not be enforcing them that much, but standards make a great deal of difference. And to some extent, they're self-enforcing. That many employers, when their HR people, their attorneys say, okay, this is what the rule is, we're going to have to meet that rule. So even if enforcement isn't great, and OSHA is never well resourced, so enforcement is never great, some state OSHA plans have very good standards, Washington, Oregon, California, etc. Other state OSHA plans are doing nothing, as you might not be surprised, Tennessee, South Carolina, etc. But if there is no state OSHA and a state is under federal OSHA's jurisdiction, they can issue their own rules. And so you've probably read that Texas and Florida cities have attempted to issue building construction ordinances saying, look, if you're working for, say, 4 hours in extreme heat, you should be given a 10-minute rest break. And I know that's been tried in Austin, in Dallas, in Miami-Dade. And what's happened in those states is the state legislatures, which are dominated by Republicans, have issued laws saying that local municipalities and counties cannot issue their own rules to protect workers from extreme heat. So that's really been quite a important and fascinating dispute. It means that workers in Austin and Dallas, for example, at one point had some protection, but no longer do. If the feds issue a federal standard, it will override any local ordinances. And so it will be of some concern if the federal government goes and issues a very weak standard, it would then block cities and counties in both red and blue states from doing their own standards that would help workers. So it's complicated, but that's all I think worth following.
Yeah, thank you, David. Really helpful. And is there any other ways that you would suggest journalists look at this risk of heat injuries among workers by industry or employer?
Yeah, I think that there's a great deal of data available that enterprising journalists can look at. A lot of them have started to look at them right now. OSHA has a couple of data sets worth looking at. There's one set of data that came up that exists only so far for 2023 and 2024 data. It's based on a regulation I put out originally in 2015 when I was running OSHA. The first Trump administration withdrew it. The Biden administration then reissued it. That employers with establishments of 100 or more employees have to essentially upload into the OSHA website data on every injury and illness that they record. And so for those 2 years, for each year, there's more than 800,000 injuries and illnesses, individual cases that have been recorded by employers and then sent to OSHA. And that's all available. It could be downloaded. It's an Excel file, and you could look at injuries by establishment, different warehouses, different sites. Um, and there's a lot of information there on heat. In addition, there is the OSHA severe injury reporting, which is a requirement, dates a little further back. We put out this, I think, in 2014, saying that every employer covered by OSHA must notify OSHA of a worker being hospitalized or have a part of their body amputated. And so again, these hospitalizations for heat are there. That's where this NBC reporter found all this information about UPS hospitalizations. So that's all available. So I've actually written some papers on describing all these various OSHA data sources. There's a paper that just went out in the American Journal of Public Health. And if you download that, so it goes through all these different sources of data. It's certainly worth pursuing on the local and state level in terms of interesting stories about heat and workers.
Thank you, David. That sounds incredibly valuable for extreme heat and just a variety of other issues as well. So thanks for sharing that. Katie, let's turn to you. Phoenix is the hottest big city in the US. It's on the front lines of dangerous heat in many ways. What has Maricopa County, where Phoenix sits, done to prevent heat-related deaths, and how do they finance these innovations?
Yes, hello from Phoenix, where we've been under an extreme heat warning all week, and today's high is expected to be like 117 or 118. So it's a very timely moment for this conversation. So Maricopa County has always been hot, but we have seen these heat-related deaths just absolutely skyrocket in the last decade or so. So in 2014, there were about 61 heat-related deaths reported by the county. Last year, 2024, there were 608. So it's absolutely exploded in the last few years. And as Alejandra mentioned, we know that heat-related deaths are probably undercounted, and we know that's only kind of the tip of the iceberg of this much larger public health problem that has many other impacts on people. As these deaths have increased so fast in the last few years here, I think there is an increased awareness or a much larger conversation about like what a huge public health risk this is. So rising temperatures are part of it. Phoenix has always been hot, but the last few summers in particular have just shattered heat records, especially at night, as Alejandra mentioned. We're not just seeing these daytime highs lasting longer into the fall, starting earlier in the spring, but it's also lasting 24 hours a day. In 2023, we had one day where the low temperature was 97 degrees. That's the highest low ever recorded in Phoenix. And that really makes heat more dangerous when people never get a chance to cool off, especially unsheltered people. So that climate aspect is a huge driver of this trend in heat-related deaths. But the other big factor is this rise in our unsheltered homeless population, which has grown also really fast in the last 10 years or so. So it's these combination of factors that have created this perfect storm that are driving up this really tragic trend. So city and county officials, Michelle, as you asked, they have responded. They have really been kind of scrambling to organize in the last few years, especially. And I've seen that as a reporter in the time that I've been covering this, where a few years ago we had this kind of informal network of libraries and churches and public buildings that kind of opened their doors as heat relief sites on these really hot days. That has become much more formalized just in the last few years. And we now have at the city, county, and state level, like full-time year-round employees who focus on heat all year round. And we have this network of heat relief sites that's really grown. And one thing they've really focused on is expanding hours at those sites, reaching more parts of the counties, adding like transportation options to get people there when they need to go there. And one of the key changes last year was, for the first time, the city of Phoenix opened a 24-hour heat relief site for the first time. Because as I mentioned, our homeless population has exploded. Shelters across Maricopa County have been at capacity now for years. It's very hard for people to find shelter, even if they're seeking it. So that was a big change last year. We also have had some policy changes, like we've had a few cities adopt ordinances for outdoor workers, nothing as kind of vast as David was referencing that some other states have, but a few kind of city level changes there. We've had policy changes in the last like 5 or 6 years here that prohibit utilities from shutting off people's electricity during the summer, which is a big thing. And we've also had our City of Phoenix fire department adopt some new emergency protocols when they're responding to these heat calls to help get people's bodies cooled faster. They actually have these, they're like body bags filled with ice that they will wrap people in as soon as they get to the scene. So these kind of policy changes and investments have perhaps started to make some difference. So last year was Phoenix's hottest year on record. In spite of that, it was the first time we saw a year-over-year decrease in heat-related deaths in over 10 years. It was a slight decrease, but officials say it is evidence that these interventions are having some kind of impact, and that without them, these numbers would be much higher and worse. There's a but, though. As Michelle alluded to, most of these efforts that have materialized in the last few years, especially the heat relief sites during the summer, have mostly been funded by pandemic era temporary funding, American Rescue Plan Act dollars, which are all starting to expire now, like this year, and they'll be all expired by next year. So city and county budgets really don't have the funding to keep this going much longer. And at the same time, we're seeing a lot of federal cuts from the Trump administration to other types of social services that are perhaps going to have a ripple effect on these very vulnerable populations that could kind of make this challenge even bigger in the next few years. So that's kind of the looming question for Phoenix. As we see these summers getting hotter now, and now that we know what interventions might be starting to make an impact, how are we going to continue paying for them?
And how have you covered this and maybe elevated this as a public health issue in the last few years, and have people responded to that framing?
Yeah, so as much as possible, I try to center my coverage around real people's experiences. So throughout the year, I'm paying close attention to issues related to housing and homelessness and these vulnerable communities. I try to keep in close contact with those organizations and have them as my kind of go-to sources. So then when summer arrives, when we have this regularly scheduled natural disaster that we experience here, I have those people as my sources. I try to spend a lot of time in shelters. I try to make a lot of visits to heat relief sites to talk, with the people who are most vulnerable to this public health threat. It can be hard to find those sources, and it can be, really sensitive conversations. One conversation I had a few summers ago, I will never forget, was with a woman in one of these heat relief sites before there were any overnight options available. And she was describing how hot it was to be sleeping in a tent on the sidewalk every night. And she told me she was actually like selling her plasma just to be able to afford a night in a motel room like once a month or so. So some really devastating stories I've heard from people, and I'm very honored that people trust me to tell those stories for them. Another story I worked on last year, I wanted to highlight the combined public health threat of drug use and extreme heat. So that involved actually combing through like hundreds of medical examiners' reports to try to find people who had died with that kind of lethal combination of methamphetamine and heat, and was able to find a family going through those reports that was willing to talk to me about this woman had lost a brother in this combination. So I try to frame my stories as much as possible around people who have experienced this. And then my kind of go-to list of sources during the summer includes like the county public health department, the county medical examiner's office, emergency room, doctors, the fire department, and then, as I mentioned, a lot of homeless shelters and homeless services organizations. One thing that I have thought about is a lot of my reporting is really only made possible because Maricopa County keeps such detailed records of heat-related deaths and releases very thorough analysis every year of kind of demographic information about these deaths. So I was going to mention to other reporters, that's probably not available in your area. I think Maricopa County is one of the only places in the country that releases such kind of granular details about this public health issue. But if you are reporting in another big city and you want to look at heat-related deaths and who's vulnerable, Maricopa County might still be a good source for you, even if that's not your local area, to be able to say, here's Phoenix, the biggest city, the hottest big city in America. We know from years and years of data there that unsheltered homeless people face this hugely disproportionate risk. We know that manufactured homes are a risk. We know that certain drugs are a big risk factor. That might be able to inform some of your local reporting, because we also don't really have a lot of that data on a national level that's very consistent, like city to city, county to county. So that's my kind of go-to list of sources and the ways that I report on this issue.
Yeah, Katie, this is wonderful. And if I could just broaden that, given our many reporters in the audience here, for all of you, what are some of the strategies that you might encourage reporters to use in trying to, both put a human face on this and also to get the kind of data that can really anchor a story?
Yeah. So like I mentioned, I think getting out there in person is always my top priority, trying to actually speak to people on the ground as this heat is taking hold, which for us is all summer and into the fall and part of the spring. That just trying to be out there in person as much as possible. I mentioned the heat related death data that I have access to here, and if you're in a different city or different county, probably don't have access to data that's quite as thorough as that. So one question you could ask your local medical examiner or coroner's office if there is a major heat wave, I think a good question for reporters to ask would be like, can you give me the raw number of cases that you saw during this heat wave compared to last July or compared to, winter? Because that's one thing that's very evident here. Even if I didn't have all of the data on heat related deaths, it'd be very easy to see if you just look at like overall drug deaths for Maricopa County, there's this huge spike in July. It's like very evident that the heat is a factor, whether or not you have the real data to confirm that. And speaking with our county medical examiner's office the last couple of summers too, before they had even analyzed all those cases, I had the medical examiner on the phone telling me all of our staff is working overtime. We have refrigerated trucks for the like excess number of bodies that are coming in. They were just overwhelmed by a number of cases. So even if you didn't have the data to be able to say like this number of deaths were related to heat, you might be able to very easily see when a heat wave is having an impact like that.
Can I add something here?
Mm-hmm.
I've looked into this question a lot about kind of why and how heat-related deaths are being undercounted. And a thing that I've tried in the past is if you have a local university, you probably have some epidemiologists who work there. They are probably good at doing what are called excess mortality or excess death calculations, which is basically what Katie was just describing. Like there is an expected number of deaths that happen every day and every week and every month in a city, that you can figure out from like past trends. And you can see when a heat event comes, if something different is happening. You can see this in the ER visit data. You can see this in mortality data. Talk to your local epidemiologist, see if they can work with you to do one of these kind of excess mortality estimates for the time period that you're looking at.
Yeah, thank you, Alejandra. That is a great suggestion. And also just wondering from all of you, it sounds like what Maricopa County is doing is impressive, and the idea that the heat is worsening, but the number of deaths has declined is notable. Are there other things that you are all seeing on a local or state level that are promising and that suggest some of the possibilities for addressing all this?
Well, I can add, I think the efforts that the Workers' Defense Project and others launched in Texas that were then overridden by state legislatures were very important efforts. And I think it would be interesting to see those occur in places where you don't have legislatures who are so unsympathetic to the needs of workers. If other states move toward those sort of requirements for building workers, for agricultural workers, I think we'd see some really important improvements in the health of workers, to essentially say you must give people breaks if the temperature reaches a certain amount and you have to work a certain several hours consecutively. The challenge, just to note, if for agricultural workers who are paid by the piece, it's really hard for them because those rates are set so they have some sort of implicit minimal wage. They wouldn't work if they got no money, but they're certainly not being overpaid. And so if you work 15 minutes less every 4 hours, you're making that much less money. And it's really can be very problematic and can be controversial. So you really would like to see employers increase the piece rate if they're going to give people breaks. That's really the only fair way to take that on.
Yeah, thank you, David. And we've also seen some reporting about how the ice raids have prompted some farm workers to stay out of the fields, and crops have an expiration date, and so that's led to some really intense pressure to have the fewer numbers of farm workers work longer hours to do the harvest. And so obviously that leads to greater exposure. I want to turn to some of the questions in the Q&A, and if you're on the webinar and you want to add yours, please do share on the Q&A panel. We have a question from Aaron Marcus, who says, do employers have to report all workers who go to the emergency department from work? Many workers may go to the emergency department and receive a diagnosis that isn't specifically heat associated, such as a stroke or a myocardial infarction, but may have been triggered by heat exposure. And if a worker goes to the emergency department when they are, quote, off the clock, would the employer be required to report?
Right, that's a great question. It's actually a couple of different questions in that the employer is required to report when a worker is actually hospitalized, not just a visit to the emergency rooms. They have to be admitted to the hospital and stay overnight. If they're taken by the employer for any reason, whether or not it's clearly heat related, the employer is supposed to report that. If they don't report it, it's actually a violation of a regulation. If the worker goes themselves, the employer doesn't have to report it. Theoretically, if the worker then tells the employer later, the employer should report, but they often don't. There have been some interesting journalistic investigations into this. In fact, I've spent some time on the phone with reporters recently who were able to show that there were fatalities, quite a few fatalities at one employer's operations, and they were not reported to OSHA. So that actually can lead to an interesting story. If you know of people who have been hurt on the job and they had amputations or were hospitalized and the employer did not report them, that actually makes for an interesting story as well.
Thank you. Alejandro, you look like you're about to weigh in on that as well.
Oh, I was just going to say, I think this gets to one of the other questions in the Q&A section too, and something that Katie was talking about at the end of her comments. But I, I think you're all identifying a really important problem here, which is that it's pretty hard sometimes to identify heat-related medical problems. Like in this question, if someone comes in with a heart attack, and they had a pre-existing cardiovascular condition, their doctor is just going to say it was a heart attack, and they don't necessarily dig much deeper. And I've talked to a bunch of people who said that when they went into the ER, like no one was asking them about the conditions that they were in ahead of time. They were just treating, their issue. But if they'd asked a whole bunch of questions, they would have found out that they'd been working in high heat for 3 days previous. We're going home to an unair conditioned home, blah, blah, blah. And this is a really active area of inquiry for a lot of medical folks, trying to figure out how to better do that kind of internal intake and assessment to figure out if heat was an issue. There's some places that are doing it really well and thinking about this really hard, and there's a lot of places that aren't. And so I think that's a thing to highlight in your reporting, to ask the ER doctors that are working in these situations, to ask the people themselves. I think in many cases too, like people themselves might not recognize what's going on. They just feel bad. And I don't think a lot of people, I got minor heat exhaustion when I was on a run at some point, and it took me like hours to figure out what was actually happening. I just thought I hadn't eaten enough. And it was like, I don't know, there's this question of awareness and who's writing down what information and even getting what information. And so I think all I have to say here is that that's very uneven across the country and across organizations and across specialties. And so you should be asking about it.
And Alejandro, just to follow up on that, who do you think is doing that well when it comes to the medical side, the ERs and so on?
It's pretty patchy, I would say. Harvard has a really interesting program. There's a couple different universities and centers that are developing climate and health education programs, and they're largely driven by younger doctors, I would say, who are aware of climate-related issues and want more, structured training on this. Harvard has a kind of most well-established one, and they've worked with fellows and doctors kind of across the country for the past few years. So I would always recommend talking to them if you want to know if there's a doctor in your state who's gone through their program or has thought about this. Washington State actually, I think, has done an interesting, at least a little bit more. Washington and Oregon, after the Pacific Northwest heat wave of 2021, which I talked about earlier, did some pretty introspective work, I would say, to think about what went wrong and whether they could start to at least code things differently. There's a whole mini movement of medical professionals too who are interested in revisiting ICD codes, which are the codes that they put on people's death certificates and on their medical records, to include more information about climate-related issues. It's already hard enough to get heat stuff on there, as we've seen. So there's kind of a little bit of controversy in that space. But yeah, I don't know. It's patchy, I would say. But you should be asking your local hospitals and emergency departments.
Yeah, thank you. And we have a question from Melinda Hemelgarn. Can anyone address heat conditions in prisons and detention centers, as well as, these are big questions, as well as farm worker health, especially in light of fear of ICE arrests if farm workers complain?
Prisoners face terrible conditions working and not working. Certainly the Texas prison system has had numerous deaths of prisoners from heat. We're sort of going clearly in the wrong direction. Prisoners are the only people in the United States with a constitutional right to health care. The Supreme Court ruled in the 1970s that if you take away someone's freedom, you have to feed, just as you have to feed them and you have to clothe them and you have to shelter them, you actually have to give them medical care. But we've retreated since that era where we care about the human rights of everybody in the country. And so attempts that have been made to ensure both worker safety among prison workers and basic living conditions, not being, broiled alive in your cell, have really been unsuccessful.
Did anybody else want to add to what David shared?
I'll just say one of the things that was fascinating in some of my reporting last year, I was writing a lot about the California recently passed a rule protecting indoor workers from heat, which I think David mentioned earlier. The process to get that rule passed was very dramatic and very protracted. It took years and years and years. And in a last minute kind of extra drama, the prison system was exempted from that rule. And we're still trying to understand why, because there are plenty of people in there and there are plenty of workers in there who face the exact same or even higher heat risks than others. But it is part of a larger trend. Of a colleague of, well, a sort of colleague of mine at Texas Public Radio has done some incredible reporting on this in Texas prisons. Her name is Lauren McGorry. You should look at all of her stories. They're horrific in some cases. It's a problem in detention centers and prisons across the country, and a space that we should all be exploring more.
Yeah, thank you. And we have a question from Penelope Overton, who asks about this question that was alluded to earlier about how to cover high heat in cold weather states where doctors and coroners don't think to consider if heat played a role in ER visit or a death. So that so much of the national heat wave data is based on hard temperature thresholds, but in Maine, an 85-degree day can be considered a top 5% temperature day. I'm guessing the answer to this is in the excess death analysis, but if there's some other aspects, please share them.
Yeah, I mean, I think the data is really bad. Like, it's bad almost everywhere except for Maricopa and Pima. There's a couple other counties that are trying to improve like what Maricopa's done, and Katie can talk about this with much more detail than I can, but like they basically, their medical examiner's office realized they had a problem and revamped the way that they did essentially all of their assessments. They went back, they sent their death investigators out to ask the kinds of questions that I was talking about earlier. They were talking to people's neighbors, their colleagues, their friends, to figure out if their AC had broken, if it was hot, and if they were like doing a different job that put them outside. They were getting the information that allowed them to be able to put heat on that death record. And most people are not doing that. And so, like, if they're not doing that, then someone has to come into the ER with heat stroke, essentially, to have anything written down for them. So the excess death analysis, to me, is kind of the way that you can at least get a rough sense of what's happening. That doesn't work in really small counties. Like, it's really, really hard to do if you have under, 100,000 people in a county. But at least you can look at the raw stats. But I think this is like a space that, I don't know, there's not like a great answer, to be honest. And there's not a national push right now to standardize or to adopt Maricopa's very well considered and thoughtful practices. Again, there are a few counties like King County, Seattle, which is Seattle, has like spent a bunch of time with the Maricopa people. LA and San Diego counties too have like tried, but they're not doing it yet. So I think this is a space that you could like actually push in your own local districts and be like, why aren't you? Are you trying? Like, what is the plan?
I might just add that your local branch of the National Weather Service should have numbers for your specific region that show like what we count as an extreme heat warning, because that's different everywhere. So like I'm in an extreme heat warning today because it's going to be 117 degrees, but the average for this time of year is like 106. So that would be different if it was like 100 degrees in Seattle today. That might be an extreme heat warning for them. So it's adjusted based on what the average temperature is for your local area. And the National Weather Service is, at least in my area, is pretty good at answering those questions for journalists and kind of explaining like what counts for you as dangerous heat. There is that factor of acclimatization. So people in Arizona are used to the heat. We have air conditioning in our homes. We kind of know what to do generally to try to keep cool. But someone in Maine or North Dakota or wherever else might not know that and might not be adapted to that. So knowing those kind of baseline weather numbers can be helpful in your reporting.
Yeah, there's pretty good evidence too that early season heat waves are a lot more dangerous than later season ones because of acclimatization, essentially. So I always, starting, well, it depends on where you are, but starting in April or May, I'm like starting to think about these stories to be like, okay, when's the first heat wave going to come? That's a time to like really get on people's radar and be like, this is a thing. You're going to be in danger more now than you are in August.
The other thing I'm thinking about is I hear all this from you is in California, there's a statewide initiative called CalAIM. It's a Medicaid waiver that, may be a little bit imperiled under the current federal administration, but the whole goal of it is to try and connect the health of people outside of healthcare systems with, uh, kind of go beyond the healthcare system would typically do, and could be, fixing someone's stairs so that they don't break their hip. And I wonder how much of that kind of funding and resources are being devoted to these kind of questions about, getting an air conditioner or something. Or Catherine, if in Maricopa County, is there like a way to do that? And even at a local level, really local level, some hospital districts have those kind of initiatives. It's not necessarily, statewide. So it'd be kind of interesting to know if those kind of progressive efforts are including climate change. And Catherine, I'd be interested in your thoughts on that.
So in Maricopa County, we talked about the pandemic era funding that's running dry. One of the programs was an air conditioner replacement program from the county for low income people. So that money is another pot that's running out. And I know a lot of our local leaders here have been concerned for years about the amount of LIHEAP funding that Arizona gets. That's the low income home energy assistance program, federally distributed. Hot weather states traditionally get less of that money than cold weather states, which have gotten more of it traditionally to help keep people warm in the winter. So that's long been kind of a sticking point for Arizona politicians wanting more of that money. And now under the current administration, there's been some even more cuts to that program. So yeah, these kind of sources to help people like retrofit their homes and live more safely in this climate are all tenuously funded, I would say.
Yeah. And going back to something I think Alejandra said, Aaron Marcus says, can you recommend a reference for the observation that early season heat waves are more dangerous than later in the season? And if you want to pop that in the Q&A
Oh
again.
yeah, I'll try to find that right now.
Yeah. And then just there's a broad question here about based on, and I think all of you could weigh in on this, based on your years of experience and personal perspective, where do you see gaps in news coverage currently, whether topic-based or geographically, and what would you like to see more of?
Certainly one of the areas that Alejandra mentioned is, I think there's a real burden of heat-related illnesses is not thought of as heat. And so to talk about that and see what's, the people, especially who are working in hot environments and going home to hot environments that never can cool down, are greatly increased for other conditions and for just generally having great difficulties with everything about their lives. And raising that concern, I think, would be something that would be very valuable to enter into the public discourse.
There are a lot of areas related to heat that I cover, like Alejandra mentioned too, where the data is just like not complete nationwide, or it's kind of like anecdotal evidence from like city officials and homeless shelters that I hear. One story that I already made reference to is one that I did last year about how methamphetamine is like extremely dangerous in the heat, and it's accounts for like a huge number of our heat related deaths here in Maricopa County. So we have some like local county level data on that, and I've done a little bit of reporting about that kind of very dangerous combination of heat and drug use. But that's something where I had even officials telling me like there's no data on this, there's no like peer-reviewed research that we can reference to even form our policies around this. Like it just feels like we know this is a public health threat, but like we just don't have the information we need to really be tackling it. That's one area that I think deserves a lot more coverage and attention.
You know, one thing I'm hearing is a bit of a through line is this idea that we're really underestimating the scope of this, and that in turn translates into whether there's resources to track all this. And if it's sort of a circular issue, because if you're not tracking it, then you don't know how big of a problem it is. And I'm just, find myself thinking about these Texas floods and, just huge coverage all over the country. It's such a dramatic event, so tragic. But how do those kind of deaths from disasters that are so vivid compare to these kind of more under the radar and maybe more dispersed incidents and their deadly toll? And should FEMA even be paying attention to this?
This is a huge issue for local leaders in Arizona. Like our mayor of Phoenix, for example, has been very public in calling for FEMA to kind of redefine their list of natural disasters to include extreme heat, because like you mentioned there is this huge federal response and media response when there is something like a hurricane or a flood. And those disasters are measured in their billions of dollars of like damage to structures and infrastructure, but they're not really measured as much in the terms of loss of life. And we know, even though heat deaths are undercounted, that heat causes far more loss of human life than any of these other natural disasters in the US. It's by far the deadliest weather-related event. So yeah, Arizona leaders have been very vocal in complaining about this. Our senators, Mark Kelly and Ruben Gallego, have put forward a bill this year. They want federal research on the kind of economic impact of heat to better understand how this disaster really does impact communities, both in terms of loss of life and just the impacts on the economy. Whether or not that bill is going to get anywhere in the current Congress is probably doubtful. But that's something that, yeah, Arizonans are very vocal about that concern and that kind of disparity between heat and other types of disasters.
If I can add another area, I think that I'd like to see more journalistic focuses around climate refugees. There's often been articles about folks coming from in South Asia, internal migrations because of flooding and heat and other reasons, people moving from the Northern Triangle because they can't make, they can no longer grow crops. But in fact, I think climate migration is occurring a great deal in the United States as well. It's not only an international issue, and I think something that is probably worth a much greater focus on here in our media, to understand what's going on and ways to make life easier for people, whether to help them move or to help them not move. But whichever it is, I think we need to recognize that this is going on.
Yeah, thank you. We have a question from Tatiana Diaz, who says, do school districts or the U.S. Department of Education keep a record of students and teachers that looked for help from school nurses because of heat-related illnesses? And if so, is it easily accessible through the web?
I don't know. That's a great question. I sort of doubt it, but that would be a great thing to explore.
I don't know the answer either, but I will mention, and I'm sorry, I don't have the link handy, but Climate Central, one of the sources that Alejandra mentioned earlier, they did just put out a nationwide report recently that looks at the impacts of like urban heat island effect on local school districts all around the US. So if you are doing some kind of like education and heat related story, that might be a good place to start.
And Katie, we have another question for you from Margaret O'Hara, and we're going a little over our end time just to get through some of these questions. And thank you to our panelists for sticking around. Katie, you mentioned extreme heat, this is from Margaret O'Hara, poses particular risk for people living in manufactured homes. What are those risks and where do they come from?
Yeah, I just did a story about this like a few weeks ago, and I talked to a researcher from the University of Arizona. Um, Gosh, his name escapes me right now, but I could look it up later and send it to you, send it your way if you're looking for it. There's also been research out of Arizona State University. Yeah, so manufactured homes, my understanding is before the mid 1970s, they really weren't like regulated at all. So, and a lot of those older manufactured homes are still in use, and they might not have really like any kind of insulation. So those ones are especially dangerous and prone to heating up. It's also these like mobile home lots where people live are tends to be less shade, more concrete, a lot of impermeable surfaces. So they're just gathering more heat. Even if you have an efficient newer unit that might have better air conditioning, you're going to be kind of paying more for the air conditioning to keep those running. These homes tend to house a lot of lower income people, so those costs can be just very prohibitive. And one thing that was pointed out to me by this University of Arizona researcher is that in a lot of these mobile home parks, they are owners of the unit, but renters of the space. And as such, they are not direct customers of the utilities. So if they're struggling with their energy costs, they might not qualify for those like utility company assistance programs. So they're, yeah, just lower income people living in these units that might be not as well suited to the heat in a setting that's kind of absorbing more heat. They might be struggling more with the energy bills and have less access to the energy assistance. So it's just kind of all these compounding effects. And the data from Maricopa County, I want to say it was last year, like 5% of our population lives in manufactured homes, but among our indoor heat related deaths, it was 25% was in those types of homes. So there are these huge disparities, and a lot of it is just socioeconomic.
Yeah, and just a related question for you and others is this idea of the relationships between other kinds of economic pressures on individuals and on families, some changes in, benefit programs and so on, like SNAP, or just local programs that will reduce the kind of stabilization that can help a family stay afloat, and how, what people are saying about potentially increases, for example, in homelessness, and how that could translate into, more deaths, more heat-related deaths. Katie, I don't know what you're hearing from.
I'm sorry, I didn't hear the very last part of what you said.
Oh, well, just this idea that you have all these other pressure points on individuals and families that could result in them becoming homeless. And you had mentioned, I believe, in an earlier conversation that the homeless shelters are full in Maricopa County. So, what are some of the ways that all of these forces kind of combine to create a greater risk of heat-related deaths?
Yeah, when you start kind of digging down on this issue in Maricopa County, it just feels like it starts like expanding out further and further and kind of involving more and more. So like one of the first facts that jumps to mind is like we had a record number of eviction filings last year. So our housing costs have been among the fastest rising in the country for the last few years. So this kind of greater issue of housing instability yeah, it is very closely related as our heat-related deaths climb. And I think I mentioned how we have city, state, and county officials now who are all like full-time employees focused on heat. We have an office of heat response at our city level, and like that director of that department has told me like my job should really be like a housing job, like or my job has to be working so closely in tandem with our homelessness services department and our housing department. And I think at the state level, you have a very politically divided state legislature, but housing has been one issue where there has been some kind of bipartisan teamwork over the last few years, because I think a lot of officials in Arizona are realizing that our housing crisis is kind of creating now this second crisis, that homeless unsheltered homelessness is just so dangerous because of our climate here.
Anybody else wanted to add to that? So maybe we could just close just to try and surface some of the places that journalists could look to understand where things are improving, promising local models or state models. Are there, who's tracking all that, and even just to call out some other places in addition to Maricopa County.
I mean, whatever happens with the federal OSHA heat rule, it's gonna take a long time to play out no matter what. So I would not hold my breath on that in any case. There's a lot happening at the state level, though. There are, I mean, at least in the heat policy, heat protections policy world, I think there were 18 states this last year that introduced some kind of heat protection legislation. Most of that didn't move forward, but some of it is. So I think there's a lot, and I think I think we said this earlier, but in the absence of kind of a federal coordinated heat strategy, at least in the near future, a lot of states have kind of stepped into, well, they're starting to step in. States and municipalities are stepping in to kind of pick up some of the slack as much as they can with the limited budgets that everyone is working with. But I think there's a ton of space to explore, and there is at least one group working in every city that I've looked at who is trying to come up with solutions, whether it's tree planting, which is like a very simple one, but pretty effective when you have 20 years to wait for trees to grow. There's places that are, building shade structures, which at least actually makes a more immediate impact. There's places that are just putting shade structures in their bus waiting zones, which is a pretty simple thing that can have a pretty, I don't know how big an impact it can be, but it's useful at all. There's places that are working on their emergency response programs. Like I know a couple other cities are looking at Phoenix's, the ice bags that Katie was describing earlier, and having those on hand. Anyway, I guess all I'm saying is that like, I don't think that, I mean, the story is evolving no matter what happens at the federal level. And there's very active community efforts in a lot of parts of the country. So I think there's lots of space to tell stories. They might not feel as like huge and slam dunk, but like the small stuff, I think what I think about whenever I hear about Maricopa is that they did not have one solution that worked. They have a lot of pieces spread across a lot of places that each have small impacts, and like that's less exciting to storytell sometimes, but it's really important.
Yeah. Well, I think that's a fitting end to our webinar. I want to thank Alejandra, Katie, and David, and to the audience for all their great questions. I'd like to thank Ryan White, our content editor, and Nadia Lozano Murphy, our communications intern, who helped behind the scenes. We'll be emailing you a survey asking for your feedback on today's program and for ideas and other topics of interest. Please take a moment to complete it. We also urge you to follow us on social media and sign up for our newsletter, which includes information on future events and also opportunities for journalists. We'll be archiving this webinar a little later today at centerforhealthjournalism.org. Thank you so much for joining us, and have a good day.